Rutland Regional is different from other institutions in the way that I feel like all the specialties collaborate on patient care. I think that, especially from a pharmacy perspective, we are very valued in the clinical care of patients, and physicians, nurses, lots of different specialties look to pharmacy for our assistance and our input on optimizing patient care.
The pharmacy department is involved in many aspects of patient care at Rutland Regional Medical Center. As an inpatient hospital medicine doctor, they're very important in the admission process. We see them daily on our interdisciplinary rounds where they provide information about antibiotics, anticoagulants, and a wide array of medications, and also in discharge to make sure that the patients are on the right medications before they leave the hospital.
Pharmacists have a huge impact in my practice from both inpatient and outpatient. Inpatient could be anything from modifying the dose of an antimicrobial based upon the patient's kidney function or liver function or a whole lot of other issues, weight or just dosing based on levels. I'm also always reaching out to pharmacists to maybe explore issues with allergies or drug intolerances or even drug-drug interactions. And in the outpatient setting, it's been huge as well.
Right now I use the pharmacist to help me decide which medications to give when, especially for new orders and antibiotics. We use them for compatibility, about IV fluids and IV antibiotics. They are utilized very heavily in our discharge process. They actually go and talk to our patients before they leave, which makes me feel a lot safer.
We decided to start developing a residency program at Rutland Regional because I feel like we had honed in on all of our clinical programs. We had developed a lot of different specialty areas and potential experiences, and I thought that it would also bring our staff to the next level on developing their skills and keeping them kind of at the top of their game as far as pharmacy goes.
They take a limited number of residents a year, and they're selective in who they choose. And when you come here, you're going to get to know doctors, nurses, other pharmacists obviously, and even some administrators really well, because it's a smaller hospital, but we still see all the range of cases you'd see at a large hospital, but you get more of that one-on-one.
So right now I'm the infectious disease and antimicrobial stewardship pharmacist, and really the pharmacy department has kind of given me a lot of independence and leadership to scope, to make the role my own, and I really appreciate that they put their trust in me and allow me to kind of use my skills and knowledge to do what's best for patients here. So right now I'm working with Dr. Cotter to form the stewardship program and kind of expand it to reach more patients right now. And we are also working on a goal to become an antimicrobial stewardship center of excellence.
A smaller institution could actually offer you more because you get to build the relationships that maybe you want in a larger institution, but you don't have an opportunity to get.
I think residents who come to Rutland Regional will have an opportunity to experience that involvement in patient care and ultimately learn how to be kind of a front-end staff or a frontline staff member who is contributing to patient care on a very integrated level.
I'm very honored to be a pharmacist here. I was very blessed to get the job here. The hospital has really allowed me to grow and develop into the pharmacist I am today.
Everyone here is really positive. We work together, and as someone who did a residency, it's a stressful time in your life, and I feel like you want to have the right people to lead you and guide you. And having only been here for three months now, I feel supported by the leadership. I've had mentors, including physicians, not just pharmacists here. So I feel like if residents were to choose our program, they will receive great mentoring and hopefully just make a seamless transition to kind of ease the stress that comes with completing an intensive program.
For all of our different learning experiences, our preceptors have really developed their skills in their areas and advanced themselves in the profession of pharmacy, becoming certified via board certification, anticoagulation certification. Everyone has developed teaching and learning skills. I think we can offer a tremendous experience to residents who come to Rutland Regional.
I'm the first board certified geriatric pharmacist here at Rutland, which is fantastic to really represent a key population here in Rutland to make sure we're doing the best that we can. The residents, they teach me something new every day, whether it's, maybe having a little fun or kind of taking a break and enjoying life a little bit more. They've been really inspirational for us here at Rutland.